joining us. We just ask that you, in the chat function, if you put your name, your organization, your location, and as we're all experiencing these restrictions and closures, what you miss most about nature in the midst of the pandemic. This episode is COVID-19 Stress in Nature, Managing Clinician Burnout During and After the Pandemic. And my name is Christian Beckwith. I am the Executive Director of SHIFT. It's a 501c3 nonprofit organization based in Jackson, Wyoming, the mission of which is to help advance and promote the health benefits of time outside. This webinar series is made possible by the National Park Service. Thank you very much for your support, as well as the assistance of Dr. Rika Virapongsi, who is the webinar series coordinator, Meredith Davison, our marketing manager, and Ariane Davis, our logistical coordinator. And this series is designed to help focus the research community on gaps and needs in the evidence base while promoting broader adoption of nature as a public health strategy. Today is a special episode that is in chapter 2, which is looking at nature as an intervention strategy from the public health perspective. We do have chapters that are coming up on conservation, land management, and outdoor recreation, all of which represent our stakeholder communities with SHIFT. And this is in the lead up to the SHIFT Summit, which will take place October 14th to the 16th here in Jackson, Wyoming, God willing, and watch that space. And today what we're trying to do is look at the ways the pandemic has increased the pressures on clinicians and the ways that nature can be used to alleviate stressors and increase resiliency among our frontline defenders in the battle against the coronavirus. We're quite conscious of the seriousness of the pandemic, particularly for folks in the front lines, and those are our healthcare providers. Last night at 8 o'clock here in Jackson, Wyoming, the howl went around town in support for those healthcare providers. We would like to thank them for the work that they're doing in the middle of COVID-19. Joining us today to discuss this important topic, we have Brooke Buckley, MD, FACS. Dr. Buckley is the Chief Medical Officer of Core Life and a board-certified general surgeon living in Maryland. She has spent most of her career in rural and acute care delivery settings. As a board member for the Maryland Physician Health Program, Dr. Buckley has dedicated significant time learning and coaching on physician wellness. As a surgeon, Dr. Buckley's career has focused on serving vulnerable and underserved geographic and economic populations. She will be moving to Detroit in June to assume the role of Chief Medical Officer of the Henry Ford Wyandotte Hospital. Also joining us is Rose Gowen, MD. Dr. Gowen is an obstetrician gynecologist and a city commissioner in Brownsville, Texas, who has been in practice for more than 20 years. As a commissioner, Dr. Gowen focuses on smart growth, quality of life projects, and health-related issues, such as raising awareness of the region's high levels of obesity and related chronic disease. Dr. Gowen was a leader in designing and developing the Lower Rio Grande Valley Active Plan, which leverages active tourism and active transportation strategies to improve the health and wellness of the region. Dr. Gowen serves on the board of Rails to Trails Conservancy, which recently adopted the project as a Rails to Trails Conservancy Trail Nation project. And we have with us Michael Tutty, PhD, MHA. Dr. Tutty is the Group Vice President of Professional Satisfaction and Practice Sustainability at the American Medical Association. He leads the organization's efforts to enhance practice efficiency, to improve professional satisfaction, and to advance the delivery of high patient care. Prior to joining the AMA, Dr. Tutty had several roles at the University of Massachusetts Medical School, where he maintains an assistant professor faculty appointment in the Department of Family Medicine and Community Health. This presentation is being recorded for later distribution via our Slack channel at Shift Nature Health and on our YouTube channel. And following the panel discussion, there will be a Q&A session. So we ask participants to post your questions in the Q&A section, and we'll get them to the panelists as soon as the conversation has been completed. So, Dr. Tutty, I was hoping that we'd be able to start with you and get a little bit of the history of physician burnout pre-COVID-19.
Christian, thank you very much for having me today. First, I wanted to just start off by, we understand the seriousness of the COVID-19 situation for our frontline healthcare workers. Unfortunately, thousands of healthcare workers and doing their jobs, caring for patients across the country, have come down with COVID-19. Hundreds have been hospitalized, and unfortunately, a few have lost their lives from this horrible pandemic. So this is a very serious conversation. At the American Medical Association, we have a lot of resources that can be reached at ama-assn.org/COVID-19. But today we're talking about a specific opportunity with nature as a stress reliever, which I'm really excited us to get into this afternoon. But burnout historically has been higher in the physician population, as it is with many healthcare professionals. Around 40 to 50% of physicians report symptoms of burnout. And by comparison to the general working population, that's almost double. And if you compare physicians to other white-collar professionals, you'll even see a larger gap. In all other settings, increased education, meaning those who have a higher education, a bachelor's, a master's, or a PhD, the higher education they have, showing that those professionals have less symptoms of burnout. That is, unless that additional education becomes a physician. And why do physicians have higher levels of burnout? It's not because they're less resilient. Actually, there'll be some research published soon in JAMA Open Access that shows that physicians actually have higher resiliency than their non-physician peers. And even the highest resilient physicians have burnout levels that are higher than other professions. And it really is because healthcare right today in America is a stressful working environment. We put a lot of stresses on physicians that take away and make it more challenging for them to provide high quality patient care. And we can see that in our current pandemic with shortages of PPE, protective equipment that physicians in frontline healthcare need, and others as well. So the current pandemic is only adding to the stresses that physicians are facing.
Mm-hmm. And can you talk to us a little bit about some of those additional stressors that have been the result of COVID-19?
Sure. There's really two types of stress that are facing physicians today. There's those obviously who are on the front lines, caring for patients, particularly in those surge areas like New York City, who may be working tremendously long hours, which is shortage of equipment, making sure there's enough drugs, ventilators, testing to care for those, and seeing a surge of patients in hospitals being filled with almost completely with COVID patients. However, in the other parts of the country, we've seen a decrease and a slowdown of healthcare as optional services and elective services have been postponed. So surgeons and physicians across the US who are employed or run their own practices are seeing volumes and revenues going down between 50 and 60%, which if you're a small physician practice and you're a physician owner, you're worried about actually keeping your doors open and maintaining the salaries of your staff and rent and others, as you're seeing patients not coming to the doctor because of some of the limitations in social distancing, surgeons not doing elective procedures. And so there's really financial stresses going on for many physicians, and we're seeing furloughs and financial pressures going on for physicians across the US as well.
Thank you. And I was curious, Dr. Buckley, what you could add to Dr. Tutty's insights regarding the factors that are driving burnout in this particular moment in time.
Absolutely, and thank you, Christian, for having me today. And to echo Dr. Tutty's comments, certainly this is a enormous worldwide stressor, and there are so many aspects that are important. And that duality of the frontline physician staff or provider staff and the group that is less able to work because of the elective work being largely canceled creates different stressors for different people. And so to be a little bit more granular on some of those stressors, I think there are probably three main areas that I would look at. Number one is workload, and a definition of burnout that I really appreciate is that it's a pathologic response to work-related stress. So meaning that it's normal work stress, but to a level that you're unable to handle in a normal or a healthy way. And so that workload being just constant and incessant for people who are in the emergency department, anesthesia, the intensive care unit, those frontline type workers. And then the workload being completely shifted for workers who normally have elective offices such as family practice, OB/GYN, internal medicine, and others, where they're trying to learn how to use telemedicine, where they're trying to understand what's going on with their more vulnerable patients, or the patients that generally would have access difficulty, whether it's by transportation or by mobility to get to their offices. The second, in addition to workload, would be the control or just the pace of change. So as we're completely shifting our work models from being able to sit in your office and have people come to you, to learn how to reach out through electronic means, and finding patients who either don't have access to media like Zoom or FaceTime, and having to learn how to do telephone conversations. And then adding on that, the complexity is, as Dr. Tutty mentioned, of running a small business through this, where 100% of the operational flow as it relates to the way that you chart, that the way that you bill, the way that you interface and talk to your patients, all of those changes for those elective practices are enormous. And then for the frontline physicians and providers, often you're hearing people say that they've seen as many people die in a week as they've seen in their entire 10 or 15-year career. We're seeing people who normally have had elective practices be repositioned to the front line. And so people who are normally around healthier, more functional people are now seeing 10, 20, 50 people on a ventilator that they really have no significant ability to see their changes towards health in a meaningful way in this short-term process. And then the third really is the ethics that people are dealing with. And so the pace is so quick and the disease is so strong, especially in the hospital setting, that to really manage what it means to only have enough resources, not only for the providers, but also for the patients, and how you deal with those questions, how you deal with very sick patients when their families can't come to the hospital, and you may or may not have time to have extended and the conversations you'd really like to have with their families as these life-altering and family-altering scenarios are happening. So, those providers generally are reaching out and saying, I just want to be seen. So the movements like the clapping off the balconies and the singing on the balconies in Italy and those things, the police driving through the parking lots of the emergency department, that opportunity for that human connection that we're all so desperately missing in social distancing, to say, I see you and I see how hard you're working and I see how complicated this is to be a human during this time, that those small acknowledgements, even though for those of us that aren't on the front line feel like, what could I possibly do in this gigantic pandemic to help, to be part of the solution, that human connection really starts to feel like a movement towards there will be a future after COVID. We will get through this and we will be stronger for it. So with that, I'll stop, but I think it's those three main pieces. It's the workload, the control, and the pace, and really those ethical challenges.
Mm-hmm. Appreciate the context, Dr. Buckley, as well as the context that Dr. Tutty provided. And Dr. Gowen, we're all simultaneously experiencing the pandemic in similar ways and then very differently. And I just wanted to ask, for you personally, how is COVID-19 affecting your experience there in Brownsville?
Well, so my experience is that I was raised to be a primary care doctor, to open a private practice. And then I got a little impatient with that, and it didn't fit my heart after many years. And so I wanted something different. And that shifted me into more population health. And I closed my practice and went to work for a community health clinic, where the pace and the attention is totally different than in a private practice setting, in very many good ways and in some bad ways as well. So the COVID experience I can see from both the private practice side as well as the clinic side. Both are frustrating. Both are very frightening, personally, that you might become infected if you don't have the right equipment. and you may not be able to spend enough time with each patient that you would otherwise like to. But on the other side, the good side, telemedicine has been really a godsend for us here in the clinic. In the clinic, we were very worried that the decrease in patient volume would really, for a not-for-profit clinic that is largely indigent, would really stress us out terribly in terms of finances. But what we found is the patients themselves have embraced telemedicine. And all of our doctors, family practitioners, pediatricians, and OBGYNs have noticed that the patients are looking forward to those phone calls from us and actually feel like they're getting more attention from us in terms of being able to speak to them for more than the 10 minutes that they get when they come into clinic. And so we've made almost a new connection with our patients and them with us. And I think that it's an education for me, my journey in life. I'm 60, so from a private practitioner to a clinic doctor to telemedicine and somewhere politics in the mix there. My practice of medicine, my calling has changed as I've changed. And I think each individual part of that has made me a better doctor in the end. For the city that is highly indigent, very, very high rates of diabetes, we do have a little over 300 cases in our county. Unfortunately, we have only had about 7 that have passed away, and our hospitals are still hanging in there. We have 2 drive-through free test sites in the city, so our city and our county are doing really well. But it is becoming very frustrating for folks that can't go out and kids can't go back to school and so on and so forth.
Mm-hmm. And I know when you were here in Jackson as part of SHIFT last year, we talked a lot about your active transportation plan and the ways that you've been using it to address some of the health disparities that are prevalent in Brownsville. And I'm just curious, we've talked so often in the months and years leading up to the last couple of months about nature as a low-cost, readily available mental health intervention. I'm curious how nature is emerging as an outlet for you in this particular moment of time in terms of.
Sure. So a lot of times in my situation, I'm running to a breakfast meeting or a lunch meeting or a 5 o'clock meeting, and I really do need my car. But in COVID times, those meetings are all now virtual. So I don't have to drive. I can take the time to ride my bike to clinic, which is about a 6-mile ride up our main trail in the city. And I have thoroughly loved it. I can almost feel my blood pressure lower as I'm riding. I can get to clinic with a clear head instead of feeling kind of fuzzy and thinking about all the things I have to fit in that day. And it's a really great stress reducer at the end of the day to be able to get out and get some fresh air and move on my way home. So it has been personally very rewarding, and I hope we get to keep some of those virtual meetings so I don't have to be married to my car every day. And while I'm out there, I've noticed the trail is very busy. People are behaving and putting their masks on and moving out of the way to maintain social distancing. But I believe all over the nation, and certainly in Brownsville as well, we are noticing a huge surge in trail use and even pop-up trails in some areas where neighborhoods that don't have access to trails are closing a particular street to car use for a prescribed amount of time so that people can have a trail if they don't have a trail. And so I'm hoping very much that neighborhood design and land use remembers some of the lessons that we've learned. People are telling us they like being outdoors in on a trail or in a green space. And I certainly have seen that personally.
Mm-hmm. And it's a great segue to you, Dr. Tutty, and you are on the board of the Lake County Forest Reserve Preservation Foundation here in Chicago. I'm curious what sort of challenges that you're seeing as part of that board in terms of increases in public use of the natural spaces during the pandemic?
I'm a very avid fan of the forest preserves in the county that I live in Lake County, and joined the development committee of our preservation foundation to help raise funds for them. We've been getting reports from the staff that utilization of our forest preserves in late March and early April is as high as we would see it even during the peak months of summer. So people are utilizing the forest preserves and trails at an all-time high, quite to the concern that we've got to maintain social distancing. So the forest preserves have put out signs on the trails about the importance of social distancing if you're walking with loved ones, moving to single file and moving to the right when you're passing other people on the trail. And unfortunately, in some cases, have had to close a few of the dog parks and some of the other facilities because the crowds were becoming too large during this time. But getting out, enjoying fresh air and taking advantage of the parks and trails is one of the things we can do during this, as long as we maintain social distancing. So it's been really great and really exciting to see that people are taking advantage of trails and parks and forest reserves in ways, particularly in Illinois this time of year. It's not the warmest quite yet, but people are still out there enjoying and hiking. Very excited to see.
Yeah, that's great. I hope it's not snowing as much as it has been here in Jacksonville last few weeks. Dr. Buckley, I wanted to ask how you recommend that patients and the public take advantage of nature, and also what exactly it means to take advantage of nature from a clinician perspective.
Sure, absolutely. Thank you, Christian. This is a really unique time because obviously there are institutional and governmental solutions that need to happen to help us move through this process. But we're all seeing, I think, as these stories that we're sharing of people being outside and using the outdoors in new ways and enhanced ways, that those personal tools and habits are becoming ever more important as individual solutions. And as we, demonstrate all of the different ways that we each individually are handling stressors, are coming across different stressors, those individual tools become so much more important in terms of each of us navigating that space. And so whether those opportunities come as beautiful national parks, or they come as the ability to walk between one building to another in between work meetings, or even what's amazing is the benefits of nature have been demonstrated just by looking out the window. Certainly the real thing is better, but experiencing nature has been demonstrated scientifically to lower stress hormones, to decrease blood pressure and heart rate, to decrease muscle tension, to increase your mental agility, meaning to be able to be more creative, to be able to be more thoughtful. And so we see so many of the physiology effects of being outside and being in nature. And so as each of us individually are almost forced in a way to reintroduce ourselves to the outdoors in new ways, because we don't have access to our cars and we don't have access to many of the modern conveniences that so many of us have come to rely on in a busy life. This opportunity right now to really focus on intentionally what is my relationship with outside and how can I do that in a better way. And in our area, we're seeing people outside on bikes, we're seeing people outside walking around, we're seeing all sorts of just so many cars at places there usually aren't because people have driven to allow themselves to wander about in nature. And so I think that what is really important is that this individual relationship changing and each of us being aware of how could I use this outdoor opportunity as part of my own well-being routine, as part of my own mental health routine, knowing that it's supported by science in terms of how it affects your body and how it affects your health. So I think those are the really exciting pieces moving forward.
And I might add to that I think it's I like your word intentional decision to make those changes. And I think for physicians, it's a time once the danger passes, to intentionally look at your practice. Is the model of your practice what you want it to be? Could it be better? Were there lessons that you learned during this time that you'd like to incorporate? Is there something you want to change about your practice? Just because we graduate with an MD does not mean we have to stick with the same practice pattern for our entire careers. And I hope that physicians will build in more connection to nature and more time to enjoy that nature in their everyday lives.
Yeah, thank you so much. And I did want to get back a little bit to what Dr. Buckley was talking about in terms of evidence. You know, last year we had a think tank on the development of sustainable revenue models for nature as medicine, particularly with payers. And I'm curious, from a clinician perspective, where would you encourage researchers to focus in order to better develop that evidence base that would convince payers to engage in nature as a public health intervention strategy? And Dr. Tutty, I'm curious what your perspective might be on that.
Christian, in healthcare, it's very science-driven, and physicians are trained to be science-driven individuals. And it's something that even during this COVID experience at the AMA, we've been promoting. We've put out statements about making sure we're using science and choosing the appropriate medications and treatment options for COVID patients. Most recently, we've been talking about let's use science when it comes to determining about how quickly we can reopen our economy and get people back and going. So, you know, healthcare is all about science. And there is some good science in nature as a benefit for your health, but we're really, you know, comparatively speaking to many other sectors in healthcare and how it's been researched, we're really at the beginning of that body of science. And sometimes it's doing the science even for things that might feel intuitive. So we all go out to parks, we all go for a hike, and we get home, we all feel better. We intuitively know that there's something about being in nature. Last summer, I spent almost 2 weeks backpacking with my son, and you know that high I had, that how de-stressed I felt, that lasted weeks and months from that. I mean, it's just so intuitive, but sometimes we still need to do the research to prove to those who are in charge that there is this value. And I'll give you an example. In 2016, we did a study, a time and motion study that tracked physicians and how they spent their day. We published that in the Annals of Internal Medicine in 2016 in a peer-reviewed journal publication that showed for every hour physicians spend with patients, they spend nearly 2 additional hours doing administrative work and electronic record work, which highlights the stress, one of the stress and burdens for physicians, that they love taking care for patients, but for an hour of taking care for patients, it's almost 2 hours of administrative work. Now, when I present that to a group of physicians, every physician in the audience says, no kidding, I could have told you that. That's obvious. It's my experience every single day. But when we have that published in a peer-reviewed journal, that becomes very powerful when you're dealing with healthcare leaders to make changes. We're dealing with regulators. We're dealing with elected officials. And then when a colleague sends me a video of a hearing going on from C-SPAN where a US senator is referencing our research, we're talking with healthcare officials, that's the power of science published in peer-reviewed journals. We've got some good initial work going on in the value of nature to improve mental health, make people feel better. But the more we can advance that science, the more we'll be able to justify investments from payers, from employers, and from the government into the importance of nature. And I think during this experience, as people are out, it becomes more intuitive, and we're seeing the environmental benefits of many people taking advantage of healthcare and not driving other things. So how can we use this opportunity during this COVID experience to continue to advance the science?
Mm-hmm. Yeah, thank you so much. And I know our research community has been instrumental in the development of this webinar series. So this is very helpful as they focus their work on developing that evidence base. We're getting some really good questions, and I want to make sure that we're able to get to them. If you have them, please drop them into the Q&A. But I just wanted to ask one other question about the sort of beneficial developments that we're seeing in public health during the pandemic that you hope will be continued afterward. And Dr. Gowen, I think there were a few that you were referencing. Do you have any that you would like to elaborate on?
I hope that building healthy places, building healthy communities, neighborhood design, the intersection of public health and planning, I hope that intersection will be tremendously highlighted, so that every neighborhood has sidewalks, every neighborhood has trail access, every neighborhood has green space that's dedicated, and that connectivity is true, and that there's a network of ways to move around your community, from home to retail to school and back, not always in a car. Can you walk there? Can you ride a bike there? And that intersection of public health and planning is one that I think some people shy away from. It may or may not be a little more expensive to design areas that way, but I hope that this tells us that with comorbid conditions, we were all at greater risk for not only acquiring but dying from COVID. Comorbid conditions are largely treated, or certainly seriously impacted, by levels of our overall health. Do we eat right? Do we exercise regularly? And so those are the areas, public health intersecting with planning and land use, that I hope that we hang on to and pay more attention to as we move forward.
Thank you. And Dr. Buckley, how do we do that? How do we ensure that the lessons that we're learning now are carried forward into the time after COVID?
So it's not going to happen by mistake. It's not going to happen by accident. It's something that is going to take all of us being very much aware of what we're experiencing, both the good and the bad, and how we move forward in a more thoughtful way. So trends that I'm seeing are enhanced communication between providers, governments, corporations, people actively trying to collaborate on the hard problems, actively trying to remove barriers to the most difficult pieces of the puzzle, whether it's bringing personal protective equipment to market faster, whether it's decreasing the regulatory burdens to be able to get providers and patients together to have those important conversations for their health and safety. I think it's an acknowledgement on the public health front that if we only pay attention to vaccine design during crises, that we will not be prepared when new opportunities arise, because there are similarities and learnings that we can carry forward if we are thoughtful enough to keep our eye on the ball, if you will. And I think that it's the opportunity, sort of taking a note from the mindfulness community, that these aren't destinations, they're journeys. And so whether it's a walk in nature, whether it's a vaccine design, whether it's healing our communities after COVID, we're not going to flip a switch and we'll be there. If you can't do 30 minutes of exercise 7 days a week, there's something that you can do that is beneficial. And as we tighten those links for diabetes, blood pressure, obesity, to healthy activities, and as we learn that, I only have 5 minutes, but I just need to go outside and take a deep breath because I need to clear my mind because I have, 6 Zoom meetings going on in my house and homeschooling and full-time work and, parents and kids and dogs and all these things. But we're learning that it isn't all or none, that it's small steps every day. And so in every facet of our personal and professional lives, and in our community lives, as we start to take those small steps, we walk towards healing. But I think we also walk to a really much brighter future where we learn that we can do really hard things and do them in new and meaningful ways.
Thank you for that. And Dr. Tutty, one more question for you, and then we'll get into some of the questions that are being posted in the Q&A. You were instrumental in elevating physician burnout as a priority issue in the healthcare provider community. I'm just curious what you learned from your efforts that might be applicable to our efforts to elevate nature as a public health intervention strategy.
Well, Christian, burnout has been something that's been getting worse in the physician population for quite some time. And in 2012, the American Medical Association decided to make a deep commitment into addressing the issues that cause professional dissatisfaction and dysfunction in the healthcare system. And at the time when we were beginning this, well, there was some folks who talked about it wasn't quite where it is today, where within the profession, across many specialty societies and the like, that and institutions implementing chief wellness officers, that this issue has really arisen in the last 5 to 7 years. But to get that sort of initiative started, the best thing that we did in hindsight, and what I think we can do to move sort of this nature as medicine movement forward, is starting with the science, building that strong evidence base, getting that science built in a way that is reputable and published in peer-reviewed journals, that provides the credibility. I mean, it's one thing to do a study and do a white paper and a report that goes on some website. It's another to get something published in a peer-reviewed journal that has a much more longevity as it's picked up in PubMed and Google Scholar, and people start to reference that in other papers. So building that body of evidence is a great foundation for building the work, and sort of then to recognize those, like what Dr. Gowen is doing in her community, those exemplars who are really moving this movement forward and starting to put a spotlight on those who are doing it well, and then providing the resources and tools so other communities can start to take advantage and make these steps in their community and recognize those who are doing it well.
Mm-hmm. And I think, last year, it really helped place a spotlight on the importance of evidence when we were discussing it at Shift. And Dr. Tutty, I think it was you that said that the science around fluoride was pretty strong, but it took Colgate coming up with Kissable Breath that really proved to be the turning point. And what I've always been curious about is, what is the Kissable Breath for the nature as medicine movement? What would it take to occupy that real estate in the public psyche that gets us to a broad adoption?
Christian, we were talking about how do you take, even when you build a science and you build a topic, how do you get the general public to get excited about it? And we're talking about the example of brushing your teeth. And there's always been science and the importance of brushing your teeth for your oral health. It really wasn't until the toothpaste companies talked about Kissable Breath and things like that sort of built a more general public to get excited by it. Because brushing your teeth, there's not an immediate day-to-day benefit on a clinical perspective for preventing cavities. It's brushing your teeth every day for 2 minutes that prevents cavities. But how do you get people excited by that? It was the Kissable Breath moment. I think it's interesting, Christian, that maybe this COVID-19 pandemic and the Kissable Breath moment is this pandemic, because now today getting out in nature is one of the few things we can do. For those who may be stressed or have their outlets for de-stressing after the work, they might go to the movies, they might go to a play, they might go to a concert. All those things are closed, but the one thing that you can do is getting out in nature, assuming you're following appropriate social distancing, of course. And it's been great to see, as we've all talked about, the usage of our parks and our trails is at an all-time high, particularly in non-summer months, which is quite exciting, to the point where I know some communities have had to shut their parks, which is quite sad because there's just too many people in them. But maybe this is the moment that people who normally are not getting into their parks realize, wow, this was something that I did because there was no other option for my outlet for myself, and becomes a moment that really people get re-energized by their parks and trails.
Thank you. Yeah, I think you're absolutely right on that. We do want to start getting to some of the questions that are coming in from registrants. We've got one from Bob Ratcliffe with the National Park Service. How have you seen nature or outdoor therapeutic benefits being incorporated or institutionalized into formal workforce wellness or fitness programs in the health provider industry or elsewhere? Dr. Buckley, what would you say to Bob?
Sure. I mean, that's certainly a question with a lot of opportunity to answer. And I think it's really in its infancy. But if you're talking about fitness outlets, certainly, and if you drive past a CrossFit place, they often have people running up and down the sidewalks and doing some of those activities out of doors and not in sort of traditional gym settings. We're seeing opportunities with some of the often tech companies that are offering more opportunity for outdoor spaces. If you take Apple, for instance, with their round building and a huge central courtyard that's gardens, and there are multiple places for thought and places to sit and places to just be still within their corporate environment. You see in hospitals and schools offering not only natural spaces, but architectural design that sort of enhance the natural spaces. Cleveland Clinic is one that has an entrance kind of fountain waiting pool that has a horizon effect. And that horizon effect offers a calming sense. And so the various disciplines that go into creating the spaces where we work and live are beginning to really come together to create solutions that create a more natural opportunity. And I think the really hard work in terms of businesses and corporations and sort of the reality of, if and when we get back to normal life, if you will, is once you get so busy, figuring out how to add that back in. And so the real opportunity here is, because it's been added by a force that we weren't asking for and largely we wish wasn't here, are there ways to go back to normal, if you will, but continue some of these habits, like Dr. Gowen suggested, of riding your bike, or of, using a park as a date with a friend as opposed to going to coffee. Are there things that we can do that we've learned in this time that will offer us the benefits of nature, offer us those stress reduction and mindfulness, both mental and physical benefits, but also allow us to get back to those productivity and all those other things that we're kind of yearning for in our old lives, if you will.
So if I might add to that, to Bob, hi Bob, to Bob's question, in our area, we have a health conversion foundation called the Legacy Foundation, and they were born out of the Valley Baptist Health System when they changed their organizational structure. Anyway, they exist to fund things that will improve the health of our people. And that, of course, then feeds to help the hospitals, because there are fewer chronically and acutely ill people going to the hospital. They have been very active, the Legacy Foundation, in funding brick and mortar trails, farmers markets, regional and seasonal exercise programs. So in our area, we've been able to attract the interest of the Health Conversion Foundation. Perhaps there are others in other parts of the country that can do the same.
Thank you very much. We have another question from Catherine Game. What can nature organizations do to support first responders during this time? Are there specific programs or tactics that would be helpful or beneficial? Dr. Tutty, what would you have to say to that?
It's a good question. I think the organizations who are representing parks and recreational areas, just making sure that people know that those are places that people can go, that they remain open, working with communities to make sure that those social spaces can remain open and people are doing social distancing. What frustrates me a little bit is we've been hearing some parks and things have had to shut because just the crowd. So how can we, those who are managing parks and the like, can make sure that those places remain open during this time as an outlet for healthcare workers and all individuals to de-stress, get out in nature, and the importance of keeping those open during this time. It's just, I think would be one of the important ways that parks could get involved.
Mm-hmm.
And if I could add too, I think, there's the second victim effect, or basically what happens to the people that are not necessarily directly affected. And I think that the parks absolutely, by helping to popularize and socialize the notion of mental health in terms of going outside and being part of the parks, that the healthier we can keep our citizens, the healthier we can keep all of us who, at the end of the day, whether you're a provider or anybody else, you're a person and you're a human trying to survive these indescribable times. And so the parks can help keep everyone healthy in this process. And ultimately, once we get through the wave of COVID, if the citizens are healthier, the hospitals and the first responders will then have some time back from how hard they're fighting now if we're all healthy on the back end, if that makes sense. If we've all come to depression and obesity and all of these diseases during the time of COVID, the hospitals will continue to be overrun and the first line will continue to have to work harder than they've ever worked before. So I think part of that partnership is the parks helping to keep all of us healthy during this crisis, which ultimately will support the first responders as well.
Excellent. We have a follow-up question from Joe Burns, who points out that nature is becoming more utilized for stress reduction. And the question is, it's two parts. Is this a good time to promote prescriptions for parks, recreation, outdoors, nature, trails, and public spaces? And the follow-up question is, how do we best talk with healthcare providers about this, both for practitioners and patients? So Dr. Tutty, do you feel
Sure.
time to promote prescription for parks?
I think, well, there's always a good time to promote. I think prescriptions or parks as a solution for that. I think there's always a good time to do that. And now would always be a great time as well, particularly as physicians may be seeing patients through telemedicine, telehealth, who may be stressed out, who are now at home, are not going to the work and have access to other outlets to take care of parks. So why haven't we got more providers behind this? And I think there's a couple of things we can do to help get physicians more engaged and to recommend that their patients who they're seeing take advantage of parks and get outdoors. First is just the time requirement. Physicians, particularly in primary care, have so many patients they need to see for the day and are burdened by a tremendous amount of documentation and other things that take away time for patient care. The good news is what I'm hearing from those who've been taking advantage of telemedicine is that the physicians have had undivided attention with their patients through telemedicine, and even now Medicare is paying for telephone interactions for those who may be in an area that doesn't have broadband or a population that may not have access to some of the digital technologies. And physicians are reporting that they're actually spending more time with their patients for these telephonic visits. So now is a great time to be referencing parks. And I know there's some great tools and those Park RX and others who are promoting that so that physicians can actually recommend parks in their area for patients who just may have not even known about this, may not even know which parks to go to and what trails are open during this time.
Mm-hmm. And to the second part of the question, Dr. Gowen, about how we best talk with both healthcare providers for practitioners and patients. How do you talk to your patients about the health benefits of time outside?
Well, you know, I didn't do it as well as I do now until I became an elected official. And that is because as an elected official, my head was looking up and looking at where are the parks in the city and where are the trails in the city, as opposed to when I was in private practice. I really was very busy, as Dr. Tutty described. You have a certain number of patients you have to get through that day, and you're thinking about the paperwork and all of that stuff. But as an elected official, I almost raised my perspective to a different level. And so when I talk to patients now, I'm a gynecologist, so I'm not seeing the person specifically for diabetes or hypertension, but I may be seeing them for a gynecologic reason that is related to the fact that they don't exercise and don't eat well. And I can talk to them about, okay, where do you live? And they'll tell me, and I will know, okay, there's a park here, there, whatever, a trail access here, there. And I can talk to them specifically about how they can connect to it. I can also tell them about the Surgeon General's recommendations of 30 to 40 minutes each time, just 3 times a week or 4 times a week. It's not a huge deal. And then when I go to my commission or council meetings, I remember, I had quite a few patients that lived in this neighborhood and there's no park and no trail access. So I can advocate on a policy level for funding and attention to be given to those neighborhoods. So it makes me a better physician. It also makes me a better elected official. And I can have those conversations in a much more educated, personal way.
Thank you very much. And thank you for the work that you're doing in Brownsville. It's so inspiring. We do have a practical question from Catherine Hughes. What recommendations for protecting yourself and others as more people take to the trails and bike paths do you have? Specifically, how do we assess risk? And would you recommend universal masking?
So I can take that first. In Brownsville, we have required facial coverings. We try not to use the word mask because it could be a bandana or a scarf. It doesn't have to be an actual mask. And we don't want people to use the N95 or the surgical mask. We want those reserved for our healthcare workers on the front line. But we have required facial coverings, including when you're on a trail or in a green space, unless you're the only one there. If you're able to maintain 6 feet of distance and social distancing from anyone else that's around, then you can pull the mask down or pull the facial covering down. But if you're passing people on a trail while you're walking or riding or walking your dog, you must put on the facial covering. It's a requirement.
Mm-hmm. Dr. Buckley, how do you specifically assess risk when you're outside in this moment in time?
Absolutely. So that's a very difficult question as the science is continually evolving. Certainly the recommendations that we have to wear the facial coverings to maintain your 6-foot difference. I think the most specific and helpful solutions that I've heard at this point is that because we are fairly sure that the transmission comes from taking your hand and placing it on your mouth or your nose or your eyes, that awareness of that transmission, that awareness of where your hands are, of what you're touching, and then of trying to stop yourself from scratching your eye, rubbing your nose, putting your hand on your mouth, those kinds of things. And so one of the advantages of everyone wearing a facial covering, picking up that terminology, thank you, Dr. Gowen, is that it reminds you something's not normal. Right? It's like a string around your finger. I have this mask on, so I should think I'm about to scratch my eye because it's pollen season here in Maryland. But I shouldn't, because maybe I've touched something that could transmit the disease. And we don't really understand, how dangerous is our mail? How dangerous is the grocery store? How dangerous is, touching a hand railing or a playground? We certainly have science to suggest that the virus can last on these surfaces for various periods of time. And so I think the specific recommendations as individuals is to do everything we can not to touch our face if we don't have clean hands. So if you haven't washed either with the hand sanitizer or even better soap and water in the appropriate manner, but it's to also remind yourself and be aware. So in a park, etc., did I touch the gate? Did I, touch the entrance areas or those kinds of places that might then be an entry for me to transmit the disease to myself?
Mm-hmm. Yeah, thank you. We're getting down to the last few minutes of the conversation here. We do have one from Joe Burns that, again, I'll bring back to you, Dr. Tutty, because I think we've touched on it a little bit already. And it's COVID has created an association between the words parks and public health more than ever before. How do we capitalize on that? How do we find the sweet spot of the relationship so that it exists after the pandemic?
Well, I think the important thing for us is to remind people about the value of parks. And it's one thing to remind them during normal times, but now that we have such an increased use of our open spaces, our parks, and our forest preserves, I think now is a great time to remind folks about the benefits of this and the investments that we should be making in our communities to open spaces and parks. I'm, as I mentioned earlier, on the Forest Preserve Preservation Development Committee, and we were putting in agenda items for our next meeting next week. And I was like, how do we take advantage of this crisis to raise funds? Because we now have more people using our forest preserves than ever. So we've raised this awareness, you know, and I think we can remind people that, you know, what would be it like if you didn't have access to these parks and open spaces during this time, when other outlets like shopping centers, movie theaters, concerts, and other places that people normally go to socialize and have outlets for themselves outside of work are closed. So, you know, I think just by what we can do to make sure that these parks stay open, by managing our crowds, promoting social distancing within the parks, and all the tips that was just suggested, so that we can make sure that these outlets remain open and people can really take advantage of them. I think it'll just be great to have a stronger public support for them in general coming out of this.
We've got our work.
I just wanted to offer as well. I think that, you know, our greatest resources are time, which we're all aware of, or our planet, which is a huge, you know, social movement, and it's human connection. And I wonder if the Kissable Breath isn't the human connection that we can find in outdoor spaces, and really just building that opportunity to be with other people, but to be with all of our, really leverage our most precious resources.
Thank you so much. And I think one of the things that we were talking about during the last webinar, when we were discussing grief and nature's ability to help us heal, was the opportunity that we have to engage in these, I think what Sonia Jakovic called these small acts of wildness, these small acts of rebellion that tap into the natural state within all of us. And so we're quite conscious of the fact that it's not simply physicians at the front lines in the pandemic, that all our healthcare workers are putting their own health on the line to protect ours. And one small act of rebellion that I would encourage our listeners to engage in is tonight, if you hear a roar go up at 7 or 8 o'clock in your community, join in and tap into something that's very deeply ingrained in all of us, and give thanks to all the healthcare providers and all the forums as they fight this battle on our behalf. So thank you very much for your time, Dr. Buckley, Dr. Tutty, Dr. Gowen. We really appreciate your insights. These conversations will continue on our Slack channel at Shift Nature Health. I'm going to switch over here to our next slide. And so we do also put each recording on YouTube. You can find it on our YouTube channel. We also put it on Figshare, and that is for the research community, and of course on Slack. Our next webinar is Tuesday, May 5th, and this is something that was sparked at the last Shift Festival. It is a randomized clinical trial that we're looking at on nature exposure for veterans, and it was inspired by some folks who were part of a military readiness workshop. The conversation on Tuesday, May 5th will be with Dr. William Marchand, Nick Otis, and Gary Wynn, and we give some insights into the opportunities and challenges that lie before this very exciting project. And then, of course, we have the Emerging Leaders Program. It's still accepting applications. Deadline is May 24th. If you have questions or you would like to apply for that, please do contact Dr. Morgan Green at drmorgan@shiftgh.org. And we are also still accepting nominations for the Shift Awards. We encourage you to nominate your work if you believe it is impactful, innovative, and replicable, and helps to advance and promote the health benefits of time outside. You can contact Ariane about that. Again, my name is Christian Beckwith. Thank you very much for joining us at this series. Feel free to reach out with us and join us on Slack to continue the conversation. Thank you so much.
Thank you.
Thank you very much.